Hi everyone, my name is Dina and I'm an occupational therapist with Physical Therapy and Balance Centers, and I'm here today to go over some basic wrist and finger stretches and some things you can do that will help you if you're having any wrist or thumb pain. The first exercise I'm going to go over is basically a wrist stretch. It's a forearm stretch and it's so wonderful. You're going to keep the elbow long and then you're going to apply gentle pressure to the back of the hand. You're going to feel some stretching through the forearm and even the back of the fingers in the hand. You basically want to hold this for about 10 to 30 seconds, and then you're going to flip it over, trying to do the same on the other side. Feeling a nice stretch. The key is to try to keep that elbow straight, shoulder down, and hold that again for 10 to 30 seconds. You can even do another stretch called the prayer stretch, where you're bringing the palms together and holding the palms together with the wrist extended. And then you're going to flip it over and do what we call a reverse stretch. We're going to move on to the thumb. If you want, you can grab a hold of your thumb and you're going to stretch that thumb back. This is an excellent stretch for the palm and the thenar muscles. Oftentimes my patients will complain of tenderness and pain, and even when they rub it, it feels sort of sore, and that comes from a lot of use of the mouse and texting. So this stretch is really effective for that as well. And next I'm going to move on to basically doing just what we call flat tops. So we're moving towards the fingers, bending it up and down 10 times. Then you can move on to what we call a claw, doing the hook fist, up and down 10 times. If you're doing these in the morning, it may be a little hard to get those fingers down. So as you continue to keep working them, it'll feel a lot easier. And then you're going to do a full fist and open. Notice I'm really trying to spread my fingers out so you can see I'm stretching out the web spaces. And then if you want, you can even try to do a gentle stretch of the fingers, just kind of pulling one finger back at a time, nice and easy. Sometimes this is a little tight, so you want to go nice and easy, just pulling the fingers back. If you're having any sort of wrist pain, or as I mentioned, finger pain or joint pain at the base of the thumb, you may want to consider some other braces and sleeves that we offer. The first one I'm going to show you is by Incrediwear. This is an incredible line of wrist braces and sleeves. The first thing that I'm going to show you is the glove. And what's unique about the Incrediwear is that they are embedded with semiconductor elements of germanium and carbon. And when they're up against the skin, what they do is they actually vibrate, and it stimulates blood flow while also helping to eliminate inflammation. So it's a wonderful, simple thing to wear. I love the glove because the fingertips are exposed. You can still use your phone, you can still use your touch screen, and it's really, really effective. Women who have arthritis in their hands, whether it's rheumatoid arthritis or if they have Raynaud syndrome, this glove is what I would highly recommend. The other item that I have from Incrediwear would be the wrist sleeve, and this one is again very basic. You're just going to wear that right over that wrist joint, and it really can be very soothing. Again, the key is to have it up against the skin because that's how these products worked. The next thing, if you want a little more support because your hands are really, really achy, you can get something over the counter, and you can get this basically at any pharmacy or any medical supply store. This is a basic, what we call wrist support or wrist brace, and it has Velcro and D-rings, and it's basically, very simple. They come in different sizes, small, medium, and large. You just have to look to see what size you would fit into. And then lastly, you can ask your doctor to have you be evaluated and seen by an occupational therapist. And the OT, such as myself, may make you what we call a custom-made splint. Here I have a wrist cock-up splint, and here it's made from a thermoplastic material that we mold directly onto your skin. So it's a custom splint just for you that you would wear, and you would wear that most likely at night to help with resting the hand and keeping it in what we call a safe or neutral position. The other splint I have here is a forearm-based thumb spica, and again, this is to help incorporate the sore thumb that I was mentioning earlier. And these splints, again, are custom fit, and they're meant to give you a little bit more of that support and help keep that hand in what we call the safe or neutral position. I hope these tips help you, and again, please pay attention to your wrists and hands because they are so important in helping us do the things that we love to do. Thank you so much for checking in, and stay tuned for more. We'll be bringing you more tips on how to stay safe and healthy. Take care, everyone. Bye.